I don't know who wants to take this from DPH, MassDPH, but I guess I've had several concerns raised to me from the neighbors living around that Allendale School area and that Allen Gate area. And the concern is, of course, with cancer. We've had people, dying of cancer, different ages. And I know, I guess my question is there data done and testing done with people around that Building 71, Hill 78 area and that Allendale school area especially, be it faculty, teachers from that school, former students from that school? Is there any type of data linking this to any type of cancer?
If you're asking if a specific report or evaluation has been done for that area, and I think that's what your question is.
Yes.
I would have to look back. Obviously, there's been work by DPH done over many, many years. And some reports do include a summary of cancer incidents.
Good evening. Thanks for being here. I know the last meeting we had last fall, you mentioned, or I asked about any data available or anything regarding what we were talking about the sicknesses and the illnesses. Is there any correlation there with the PCBs? Or so I don't know if you said you were going to try to pull some data and see if there was any available.
The most recent report that includes a summary of cancer incidents is the DPH GE Housatonic River Public Health Assessment that was released in 2008. It includes a summary of a descriptive cancer incidence assessment that was released in 2002. This includes data for the towns of Pittsfield, Lenox, Lee, Stockbridge, and Great Barrington, and also for smaller geographic areas within the communities.
So there isn't any other report that's later than 2008?
That is evaluating the cancer incidence data for that area. No, not that we have.
So how would we request to have another study done? I very much appreciate the website to look at the dashboard and the tracking the numbers, but I don't think anybody on this in this group are, aside from Brenda, maybe you, an epidemiologist, and able to really fully comprehend and understand the data. And so I think having that information available to us would be appreciated. So I'm just wondering can we request a study be done of cancer rates in this area?
It sounds like, if I'm understanding correctly, you'd be interested in an update of that data. So basically from 2001 onwards.
Yeah, I think so. And I think that would be great. And then if we could come back and be able to be presented with that data, that would be really helpful. So how long do you anticipate that this review will take?
So
do you want to take that?
Sure. So that's always a tricky question, and always it's a good question to ask. The length of time for an evaluation, it depends on several factors. So it depends on our current project load. So we do evaluations like this for communities across the state. The availability of data. So we'll work with the cancer registry to make sure that we have the most complete data before starting to analyze that information. And it also depends on the scope, how wide of a scope we're doing. So I don't, unfortunately, I wish I could give you a good answer. And it's hard to come up with, a good time frame. I would say, a ballpark idea is that it takes at least several months for the evaluation to be complete. And then it will need to go through senior level staff review within DPH. So I don't have a better estimate to give you at this time, but I hope that gives you some sense.
So we evaluated the cancer incidence a while ago, and that report was released in 2002.
So this is an update to that same report, looking at similar cancer types. They're doing the epidemiological review now to look at the literature to see if there's any new findings, new cancers that have been associated with PCB exposure, so we can add them to the grouping of cancers that were looked at previously.
Is there a time frame for the completion of the report?
I don't have a time frame right now, sorry.
Thank you.
Well, I was just thinking that there is a lot of concern in the neighborhoods that people are getting cancer at a very young age, especially, which is a red flag, of course. And it's really important that that's be really, is it real? Is it PCBs? Is it something else? Or is it background? But so that's where this is an important study.
What's the time frame for the report to be completed?
Yeah, good question. So I would say it's always the magic question, right? And hard to answer. There is a lot of data crunching and data analysis and interpretation that's going to be involved. So my ballpark would be, I would say, on the order of like 6 months, probably not less than 6 months. It could be a little more than 6 months, but just to give you like a general idea.
Those 5 communities, we're looking at 10 cancer types, and we're looking at a 25-year period. So we're at the phase where that data analysis has been done. We're starting to write the report and interpret the results, and we're hoping to release the report by the end of the year. So if you have questions about cancer, we should have more information for you forthcoming. So we've completed our data analysis, and we're currently interpreting the data and engaging in report writing. So we anticipate releasing a final report this winter.